Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today and happy Halloween. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Very good Halloween day. Thank you.
Dr. Robert Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone U.S. COVID statistic through today, October 31st. We invite you to submit any questions or suggested topics down below via Facebook at NU Institute for Global Health or via email at globalhealthinstitute@northwestern.edu. Starting with that COVID statistic, average COVID deaths per day in the last reported week were 84 daily. In the same week in 2023, we saw 187. Your reaction to those numbers, Dr. Murphy?
Yeah, it's really no difference from last week, basically, and a lot better than last year. So I think as the overall immunity and the vaccine strategies play out, these are the kind of numbers we're going to see. It's a little bit disturbing, I think, that the number is still like close to 100 deaths per day. This long after the summer bump, because we're just about ready to go into the winter peak. So we'll see, but it's better than last year. And the wastewater data is very good, low everywhere in the United States.
And has the XEC variant gained any more ground?
Yeah, so the variant that is the most common now in the United States is called KP.3.1.1. But XEC makes up 17% of the cases, and in other parts of the world it's taking over. So what does that mean? Why does one take over? It takes over because it's easier to transmit, so it beats out the other one. And this relates to some of the mutations that occur in the spike protein that allow it easier access into the human cells.
And before we move on from COVID this week, there was big news with the CDC expanding COVID vaccine recommendations for people of certain ages. Can you explain the new recommendation?
Yeah, well, the immunity to COVID, as we know all along, it doesn't last that long. That's why it's like the flu. Same thing with the flu. It doesn't last that long. So for people who are over 65, or if you have a moderate or severe immunodeficiency, they're recommending that you repeat the vaccine that came out in September. If you've had that already, or you're getting the COVID vaccine now, repeat that 6 months later to keep your immunity up for the next summer bump, if we have another summer bump. But we've had them every year, so it looks like this is going to be, a double type of peak. 2 peaks a year, and so you want to be prepared for the summer one.
Absolutely. Now, another national story. Oh, excuse me, continue.
No, it's a big change in the recommendation, but it's just for those super high risk people.
Yes, so not for everyone, but if you are 65 or older or have a moderate to severe immunocompromised, you should be looking for that second vaccine 6 months after your first.
Exactly.
Now, a big story this week nationally has revolved around E.coli linked to certain McDonald's products. Can you tell us how many people have been sickened and why they might have gotten this E.coli?
Well, it's very important because it brings up a lot of things. Plus, McDonald's is headquarters here in Chicago, and it's caused the company just a lot of havoc. So 75 people in 13 states have gotten this E. coli infection. Why is that important? Well, they get sick. That's why. Colorado has seen the most cases of 26, followed by Montana and Nebraska. You can die from it. And there has been one elderly patient actually has died from the current epidemic of 75 people, an elderly patient in Colorado. So this E. coli causes these infections in 74,000 people per year annually, resulting in 2,000 hospitalizations and 61 deaths per year. So this is why, you know, we always look at that. They can become very, very sick from this infection. So it's really been, you know, a nightmare for the McDonald's people. They identified a company called Taylor Farms as one of its suppliers of onions in Colorado, as well as another grower of interest, but that hasn't been proven yet. And they've Taylor Farms has since recalled yellow onion projects, slivered, diced, and whole, because of the contamination problem. Oh, corporate food distribution, I think, is something that people have to really understand. 900 of the restaurants, McDonald's restaurants in Colorado, Kansas, Wyoming, receive onions from that source. Some were also consumed at locations in airport hubs. So you can see how this thing, you know, if one place has, you know, infected products, how the distribution system, you know, works, you really can spread it very quickly. And that's why it's very important, you know, for the public health people in every state and the CDC, you know, stay on top of this thing right away and stop it at the source.
And crazily, this morning, the FDA actually updated that 75 number to 90 cases of infection. So can you explain a little bit why some infections like E. coli maybe will take a few weeks to show up?
Well, you know, a lot of people don't get that sick. And so it takes really somebody getting super ill to actually trigger the investigation. You know, a lot of people have, you know, little diarrhea or, you know, whatever, and, you know, they don't think too much about it and they resolve on their own. However, when it starts really a lot of people in one particular area, or somebody gets super ill and ends up in the hospital, that's what triggers these investigations. And it's certainly what happened here. But
That makes a lot of sense.
they identified it, and it's really not too far into the game. So it's good. We'll prevent infections.
Now, a global story that we have been talking about for months now is Mpox and the outbreaks mostly out of the Democratic Republic of Congo. It was just announced that Britain has identified their first case of this new variant. Can you tell us a little bit about it?
Yeah, this is the clade 1b Mpox variant we're talking about. Remember, clade 1 is the one that's mostly in sub-Saharan Africa and is not spread around the world like clade 2 is. But 1b popped up and has been found outside of the African continent, and Britain has reported their first cases. If you look at it in total, there's 44,000 overall confirmed cases in Africa this year, with 1,000 deaths, mostly in the Democratic Republic of the Congo, but many other countries have reported it as well.
Something we're keeping our eye on. We're looking for updates on the vaccination campaign as well. We will share those when we have them. Our other huge topic, continue.
Also to note here is that this person did travel to Africa. And so, you know, taking a good travel history by the doctor, or if you're a patient, if you're a person, you get sick, you have some lesions or something, you know, make sure you tell the doctor where you have been.
Absolutely. Very, very important. And our other big story that we have been reporting on for months now is H5N1 avian flu. There are a couple of updates, one about the Missouri patient and those surrounding cases, and just about the animals as well. Can you bring us up to speed on all that's happening with the avian flu?
Oh, well, we'll start with the animals. So a pig got it. The first pig in the United States was confirmed to have avian flu. So that's yet another animal. The pig didn't get sick, but the pig had it. 2 other pigs tested negative, and 2 other pigs got tested, but the results are pending. So anyhow, just yet another animal that can get avian flu. Then there's that whole issue about this Missouri patient who was not around any animals who got avian flu. So this is the big mystery. Is this going to show that, you know, human to human transmission? Is this going to get out of control here? So there were the evaluation of this person, kind of just stumbled along, and they tried, but it was not so easy. There were 5 healthcare workers who got a little bit sick after being around this person, and they finally all got tested and everything, and they were all seronegative. In other words, they didn't have it. They did not have avian flu. There was another close contact to the exposed patient who also had been sick, but that person had really kind of inconclusive test results. One test was mildly positive, 4 other tests were negative. But anyway, the point is that doesn't really matter. That person didn't spread it to a whole bunch of people. So if it goes human to human, it's very rare. So I think in a way that's really good news.
Yeah, very good news, and very happy to finally have some solid data to report on with that situation. And another situation that can be very dangerous is pneumonia. There was a new study out about the available pneumonia vaccines and what could provide the best protection. Can you tell us what the best protection is?
Yeah, so the regular old bacterial pneumonia, strep pneumonia, can be prevented by the pneumonia vaccine that's available in pharmacies around the country right now. A lot of people have had it. They had the Pneumovax, was been around, that covered 13 different types. But the new vaccine that has come out is called PPS V23. It goes after 23 of the types of pneumonia there is. And it showed in this very large study in the Veterans Administration system, which has millions of patients in it, 3 million patients were included in the final analysis. This is gigantic. And they've had a electronic medical record for decades, so they know what happens to all the veterans. So they described the veterans and looked at those who had no vaccine. They looked at those that had just the original one, the PCV13 alone. And then they looked at the ones that had the new vaccine, the 23, and people that had both of them. So what happened? The greatest protection against pneumonia among those patients that received the combination of the original one plus the new one. And that was almost a 50% reduction. This is a potentially life-threatening illness, especially if you're older or have any other immunocompromised condition. So this is like a fantastic way to reduce hospitalizations and deaths in people at risk for pneumonia. It works really well. So it's the final take home is if you should be taking this new pneumonia vaccine, the regular bacterial pneumonia vaccine, PPS V23, just take it, and you're going to be protected from pneumonia. And your risk for pneumonia, of course, goes up with age, or if you have any other underlying immunologic or lung conditions.
Mm-hmm. Now, these vaccines are primarily for older adults. I understand there's also been some news about potentially a different type of pneumonia, if you could explain that is on the rise in young children.
Yeah, it's often referred to as walking pneumonia. It's caused by the organism Mycoplasma pneumoniae, and it's a walking pneumonia. Usually you don't get that sick from it, but you can end up sick and in the hospital. And they found a big increase in young kids, 2 to 4 years old. Only about 10% of people who get infected actually get pneumonia. So it's not a really invasive and super serious disease, but it does happen, especially when so many other things are going on, in the population. So in the last 6 months, this Mycoplasma pneumonia has been higher than before the pandemic, because during the pandemic, COVID is so contagious and so nasty that it just wiped everything out. Remember the first year of COVID, there was even no flu. It beat out flu. So, but anyway, this is just something to keep in mind, especially in young kids, that they could have this if they get sick.
Mm-hmm. Another thing to look out for. And Something, our final story for today, very rare in the United States. There was a patient in Iowa who may have had Lassa fever. Can you tell us a little bit about Lassa fever itself and about the patient?
I think they did have Lassa fever, and they had been in West Africa, where Lassa fever is predominantly located. Um, this person unfortunately passed away in Iowa. They made the diagnosis. Typically in West Africa, there's between 100 and 300,000 cases per year. It's spread to humans through contact with rodents. So it's usually people in rural areas. You don't see it in big urban cities usually. And very rare in the United States, but annually in mostly West Africa, there's 5,000 related deaths. So it's about a 1% overall mortality rate. But if you get sick enough to end up in the hospital, those patients, the mortality rate is 15%. So this person, unfortunately, didn't make it. They died while in isolation at the University of Iowa Medical Center earlier this month. They added that the patient was not symptomatic when traveling to Iowa from West Africa. So the risk to fellow airline passengers or anybody they came in contact with is very low. They were not probably not transmitting. So rarely person-to-person transmission can occur. And it's even been reported to occur during sexual contact. So they're following the contacts of this person for another 21 days, make sure nobody else gets sick. And that's really the story of Lassa fever.
Very tragic. And a reminder, if you're ever traveling, make sure you research and are up to date on all of the viruses and infections that are endemic or common in the area and find ways that you can potentially protect yourself or avoid that. Just a really tragic story there.
And if you do get sick, make sure that the healthcare people understand that you have been traveling in an area that has these infections. That's the most important thing. That'll trigger the correct evaluation.
Absolutely. On that note, thank you so much, Dr. Murphy, for your time and your expertise, breaking down the stories, the statistics, and the research. It is much appreciated.
I mean, whether you're eating hamburgers in Colorado or traveling in West Africa, it depends. So
Mhm.
careful out there, and have a great Halloween.
Absolutely. Happy Halloween, everyone. Thank you for joining us for this week's episode of the Ask Dr. Murphy series. If you have any questions or suggested topics, please leave them down in the comments below or any of our social media linked in the description. We hope to see you next week. Have a great Halloween and goodbye.